Have you ever had pain in your knee? I mean, that sharp pain that it just hurts? Well, my name is DrJason. I'm everybody's favorite chiropractor. I'm here to align spines and minds, and this is our active health tip where I'm going to teach you how to get rid of knee pain in 5 minutes. Now, quick disclaimer is that there are many causes of knee pain. You can have a meniscus issue, you can have a degenerative issue. There are some causes of knee pain that would require you to see an orthopedic surgeon. There are some causes that would require treatment by a chiropractic doctor such as myself. And I'll tell you that the nerves that come out of the lower back, especially the lumbar area, go to the leg. They go to the quadriceps, the knee joint itself, the hamstrings, the popliteus, a lot of those supportive muscles. So many times people's knee problems are actually compensatory to a lower back or lumbar subluxation spinal misalignment. Having said that, you can also have a knee problem, you can have a knee problem, a spinal problem, or you can have both. In this case, if you feel a sharp pain in your knee, especially on the inside of your knee, whether you're cutting from side to side when you're running, maybe it's when you're running from the impact. If you feel that sharp pain, a quick hack that you can do is this. Number one, you're gonna put your leg up on something like a chair here, and you're gonna palpate and feel your knee there, and you're gonna look for this muscle right here that's rounded. This is called your VMO, vastus medialis obliquus. And what you're gonna do is you're gonna touch, and there's probably a point that is both tender and it kind of feels good when you press on it, like, oh, that's the spot. Usually what happens is, it is again compensatory, but knee pain, oftentimes you get a micro tear of the VMO, and that is because your lumbar spine is not being flexible. It's not moving properly. Every step you take, every move you make, you're putting undue stress on one knee. So what you're gonna do is you're gonna hold that spot. You're gonna give it a little gentle self-massage, self-rub there. Notice I'm using my thumb. I'm using my hand like this. I'm digging in just a little bit. Kind of hurts, kind of feels good. I'm gonna dig in right there. And usually what's gonna happen is if I dig in for a moment, and I kind of go back to the knee, bounce around a little bit, cut from side to side, you're gonna notice, oh, that feels a little bit better. Cool. Now, the next thing is you're gonna understand that most knee problems are actually a compensation. So what you wanna do, and we've gone over this before, but you wanna get ideally, I'll show you ideal first, ideally into a low squat where your legs are straight ahead, your feet, your toes are straight ahead there, and you're all the way here, and then you're gonna pull up through your chest. You're gonna breathe and you're gonna aim to sit here for 1 minute at first, go 5 minutes, and then up to 30 whole minutes. If you can't do that, you're gonna modify by turning your legs out. This is gonna improve motion in your lumbar spine. It's gonna put motion to your lower back, your mid back. It's gonna stretch and challenge your knees. But if that doesn't work, what you may have to do is squat down a little bit, hold on to something, hold on to a bench, hold on to a chair, get some sort of a band or a rope, and you're gonna hold on here. And what you're doing is you're challenging your knee in what's called an isometric contraction. When you're doing a halfway squat, you're forcing muscles to work that don't usually work. Then what you're gonna do is work your way down, all the way down. And again, even if you have to widen your stance, all the way down like this. And when you get down really low, you're putting your knee into motion, which it's designed to do. You're opening up the lower back, putting motion into the disc. Not quite like a chiropractic adjustment, but it is helpful, and it's gonna also mobilize your hips. If you do that for 5 minutes a day, again, that's gonna help drastically. Key points. Number one, your knee problem could require an orthopedist. A chiropractor also may be able to help you. Number two, the nerves that come out of the lower back, specifically lumbar spine, upper and lower, go to the knee. Definitely wise to get your spine checked if you've got a knee problem. Number three, it's usually the VMO that is a micro tear, micro avulsion when you have an injury. Contact with your thumb, find a sharp and tender point, use your other hand to dig in, do a little self-massage. After doing that for about 10 to 30 seconds, cut from side to side, squat up and down, see if you notice any relief. That can help you with a lot of knee pain. If you need more than that, go to your chiropractor. So many times, as we mentioned, when the person has a knee problem, it's going to be their VMO, this muscle right here. And so if you were to come into a qualified chiropractor such as myself, and we were to actually look at the knee, remember first we're gonna look at the lower back, we're gonna do our analysis. take some pictures of the spine, check for subluxation or spinal misalignment. But in the knee, in this case here, this is what I'm actually looking for. Probably want to come around this way a little bit. So I'm going to test her quads, push up here, push, 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 strong. And then when I bring her foot outwards, hold right there, push, push really hard, push, 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 push. It's not quite as strong. That would indicate a weak VMO. And then if I just get into this point right there, which I could see her contorting and giggling, and maybe that's tears. Okay, and then we're gonna toes out for me, toes out, push up, push, 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 push up. There. You see it's really strong now. And so the difference is huge. And so then we would correct that muscle imbalance, we would correct the associated muscle imbalances, adjust the lumbar spine as indicated, and that's why you'd want to go to someone like myself, a chiro, and check it out. In the meantime, do what we showed you and get rid of knee pain in 5 minutes. The muscle work, we didn't want to have her crying on the camera, I'm kidding. Then what we're going to do is we're going to go ahead and adjust the knee. And so in her case, what we're going to do is we're going to adjust the knee laterally. So I'm going to have my hands underneath her femur there, relax your knee all the way. There we go. And nice little release there under the knee. We brought the tibia forward on the femur. So we corrected the muscle imbalance. We adjusted the knee. Again, we would have checked the lumbar spine in all cases. In the meantime, again, you can use what we showed you to get rid of knee pain in 5 minutes.